We go inside your health now. So the CDC is likely to change their recommendations for COVID isolation. Since 2021, the agency has recommended that people with COVID isolate for 5 days and then continue to wear a mask for an additional 5 days. But according to reporting from the Washington Post, that recommendation is due to change soon. We have our KSTP health expert here, Dr. Arkel Georgiou, now to bring us some more insight on all of this. Okay, so the recommendation's changing. It's been a long while since they've changed. I think even here in our newsroom, people have questions about what do we do with it now? So what can we expect? What will the new recommendation look like?
What we can expect is that they're going to be a lot looser than they were. So here's what we expect the new recommendations to be. One is that if you test positive for COVID and have no symptoms, no need to do anything at all. If you don't have symptoms, don't have a fever, you don't need to isolate at all. If you have a fever, isolate, keep yourself separate from other people while you have a fever. But once you're fever-free for 24 hours, then you can go back in doing your usual activities. What we don't know right now is what the recommendation is going to be around masks. So that's still a little bit of a question mark.
Still a question here. But the other question is, why now? It's been a while. People have been wondering if this was going to change. Why are they doing it now?
Yeah, finally, right? It's about time. So they haven't updated those guidelines since December of 2021, and a lot has changed since then. Maybe the most important piece of data that went into consideration is that there was a study done by the CDC that showed that over 96% of people have some level of immunity, of adults 16 age or older. It could be through vaccination, through infection, or both of those things. So if 96% of the population has some level of immunity, then the risk of the virus is less than when none of us had ever been exposed before. But the second reason, Leah, is that public health recommendations have to be practical. So there are people that we know are not even testing to see if they have COVID because they don't want to have to stay away from work for 5 days. So the CDC takes behavior plus science into consideration when they make these new recommendations.
There's got to be some controversy over this. Some people have strong opinions on different sides of the issue, though, right?
Well, there's always controversy.
Yeah.
And, you know, what's coming out that various experts are saying is that they don't want this change in the guidelines to suggest that COVID is just a cold or it's just like the flu. It's not. It's more serious than that. It's causing double the number of hospitalizations. That being said, it may not require the level of isolation and restrictions that we've seen over the last several years. So in line with the fact that there will be more people navigating that are infected, the groups that are most concerned are those who are older, those who are immune compromised, because they're going to have to be even more careful because they are at greater risk.
Sure. So California and Oregon already loosened their restrictions. Those two states did.
Right.
Have we seen any data on how that's changed things there?
Well, California just changed their guidelines on February 1st. So it's probably too early to say anything about them. But Oregon changed their guidelines last May. So when we look at what's happened in Oregon since that time, certainly they had that winter spike just like every other state, but their hospitalizations have been no different than any other state. So one thing that I do want to point out, though, is that both California and Oregon have still required masking for 10 days.
Okay. All right. So we're going to see what comes out here very soon.
We'll see. Probably in April, they'll issue those guidelines.
Okay. Not far off. Arkel, thank you so much.
Thanks.
We will be right back.